Hi, this is Dr. Hossam Elzeiny. I am a fertility subspecialist with Melbourne IVF. I'm having experience in this field for 20 years, and welcome to The Fertile Minds. Today, we are going to talk about how to prepare the endometrium or the lining of the uterus for implantation. We are talking here about a patient who had embryos in storage, or even patients who are egg recipients. So that's how we are going to prepare them for implantation. The whole idea is that we try to synchronize the age of the embryo. Most of the time, all of the embryos will be frozen by day 5 or 6 or 7. Although there is day 6 and 7, when we transfer them back, we put them back on track. So we want them to be day 5 after ovulation or after we start the progesterone. So how we prepare the cycle. So if it is a donor egg and recipient eggs, it's easy. We can get them, if both of them having menstrual cycles, then we can synchronize the start or the beginning of the cycle by giving them oral contraceptive pill beforehand. And then we stop them, both of them will start their period at the same time or just one day difference. And then we are talking here about the egg recipient, how to prepare the endometrium. So we give her sequential estrogen and progesterone. The common form of giving the estrogen is via oral tablets. You will take the oral tablets from the beginning of the cycle, and then around, say, after probably 10 days from taking the estrogen, we do an ultrasound to check the lining of the uterus. We like it to be above 7 millimeter. And then at that point, we add the progesterone to the estrogen. And then 5 days from starting the progesterone, that will be the time of the embryo transfer. And about 9 days after the embryo transfer, we do a pregnancy test to check if pregnancy has been achieved or not. And nowadays, we check the progesterone level as well. We like it to be above 40. So we can supplement with extra progesterone if we need to, according to the progesterone level. So that's one type of cycle. In general, if you have frozen embryos and you want to do the transfer, the most important question to the lady who is going to have an embryo transfer is, do you have a regular cycle or not? If you have a regular cycle, then we can do what we call natural thaw cycle. And here we don't give the lady any medications at all. And we will just monitor when she's going to ovulate. That will involve doing an ultrasound close to ovulation to see how big is the follicle. And then we do a blood test to check for the surge that happens 1 day before ovulation. So we can pinpoint exactly when ovulation is going to happen. And again, 5 days after ovulation, we do our embryo transfer. So what about patients who will not have a regular cycle? Then they have one of two options. Either we give them sequential estrogen and progesterone, like the one we talked about in the egg recipient cycle, or we can induce ovulation. These patients usually have a condition called polycystic ovarian syndrome, and they don't get regular periods. They can have a period every 2 months, 3 months, or even no periods at all. You can induce ovulation here with certain type of medications. There are tablets that can be used. There are injections that can be used. And here you are inducing ovulation. You get them to ovulate and monitor them the same way. You do an ultrasound. And then in most of the time when you are inducing ovulation, we trigger ovulation. We give them a shot of injection that will make them ovulate after a day and a half from the trigger injection. And that will be the day of ovulation. And then again, 5 days after that, you do the embryo transfer. So these are the 3 modalities of preparing the endometrium. And as you can see here, that all is what is needed to prepare the lining of the uterus is just estrogen followed by progesterone. So you try to mimic what happened in natural cycle. Sometimes there are some additional medications that can be used, but that all depend on the condition of the patients and the history and so on. But most patients will achieve a pregnancy through this kind of preparation. The last question that we get, doctor, what is the best method of those 3 methods that you have told us about? Is there a like a higher pregnancy rate when we do natural compared to the artificial cycle? All of the studies that has been done before comparing those 2 types didn't show any superiority of one modality of treatment over the other. But we go with the first with if the cycle is regular or not, and then we choose one of 2, either the natural cycle or ovulation induction or artificial flow cycles with the supplemented hormones. And I really wish every couple who is going through this kind of treatment a successful outcome. And if you like this video, please subscribe so you can get more videos from Fertile Minds.